Hi again, Bill Fox here with Las Cruces Public Schools TV, continuing the conversations I've been having with some of our district employees. And today I wanted to talk to Gabe Jacquez. He's the Deputy Superintendent of Operations. And I thought we'd have a little conversation. I know things change minute to minute, second to second sometimes, but as the district moves closer to returning to some kind of in-person instruction, a big part of New Mexico Department of Health and the New Mexico Public Education Department is what's called surveillance testing. And that's one of the more obscure things, but it's also something that the Las Cruces Public Schools has just kind of started to hammer down. And I thought you would be the perfect person to talk to about that. So welcome, Gabe, and thank you for joining me this afternoon.
Hey, thanks, Bill. Great to see you.
So talk to me a little bit about surveillance testing. I was reading the CDC guidelines, which is, like science speak that I don't speak. But it's, if I'm understanding this right, surveillance testing is a way to, as opposed to individual testing, surveillance testing is a way to monitor the move of disease and the virus through groups of people, so we can see trends as they go up and down, and just a better way of looking at it more as a community. Do I kind of have that right?
Absolutely. Yes, you're on the right track. So, I mean, basically it's a tool that we use, when we look at kind of at the public health sector, exactly to what you said. So it's really looking at, it's monitoring kind of that where we're at what level we're at. So of course, this pandemic is a perfect example of that. So it's really looking at are we increasing? Are we diminishing kind of that, the positivity rate, the spread rate? It looks at a bunch of different things depending on how you do it. And like I say, from a community health point of view, that would be kind of something, if we did that in Doñana County, would be looking at our entire community. So doing it within our school system is looking at that from the organizational level. And, of course, one of the biggest things for us, safety is super important, right? And we want to make sure, for the sake of staff and students, that we're doing and implementing everything we can to kind of keep that at our highest priority. And again, just kind of monitor where we're going with this. We're all super anxious and excited to get back to normal, to get kids back in classrooms, to start kind of bringing some normalcy back to education, because we know, when we're working with people, one of the hardest things is to do what we're doing here, virtual, right? And we're not necessarily wired sometimes for that. Even though we have had some great successes, we're just as anxious to get ready. So hopefully this will be one of those tools that'll help give us some data and some indication and get us in the right direction.
Thanks. Okay. I was looking at the New Mexico Public Education Department reentry guidance packet, which for people out there, we're not going to get into all the details of this today. And Gabe, I hope soon in the future, maybe after the holidays, we can sit down and pick through some more of this, because this is actually a very good presentation. But what they talked about as for requirements for reentry is surveillance testing at a district level. Explain to me a little bit, we talked about the meta, explain to me at the district level kind of how it's going to work. We don't need all the details, but just kind of like, give me the quick version of how the district plans to implement surveillance testing here in Las Cruces Public Schools.
So one of the things to point out, Bill, as we jump into that discussion, is we were kind of in the fall semester, it was a requirement for any schools that came back into a hybrid setting. And so since we stayed completely remote, aside with the small groups and the small pods, the 4-to-1 pods that we were doing, that wasn't a requirement for us. And at that time in the fall, the state and Department of Health were requiring a 5% surveillance of staff every week. So you would take 5% of your population in our organization that were coming into hybrid. So those were only the people that were coming to do in-person learning, and you would run surveillance testing on that group. Currently, the new guidance that just came out recently is that they're requiring a 10%. So theoretically, we will go through 100% of our staff that are coming in person for any in-person activities. We'll cover that in a 10-week period. So surveillance testing isn't a one and done. So if I'm chosen for the first week, For example, we're starting January 4th. So if I'm chosen for that week, I could pretty much count on 11 weeks later retesting or having another surveillance test. So just to kind of get that out there first. But how it's going to work in the district, it's actually pretty cool. We've been doing a lot of work this week. As a matter of fact, I'm in the middle of doing that now. We're not using necessarily a random selection process. We're just looking at the number of people. Like I say, we'll get to everybody somewhere. So what we're going to be doing is we'll be selecting our first round this afternoon. As a matter of fact, we're going through and calculating out. We've asked principals to get us numbers of people that could possibly be coming back for in-person learning after Martin Luther King holiday. So that would be January 19th. So we're also required to do a 2-week period prior to that date, bringing kids back and reaching that 10% threshold. So with that being said, we're starting out January 4th. So we're working on selecting those folks. We've identified, principals have helped us identify folks that are going to be possibly coming into buildings and doing some in-person work. That also will include our essential workers who, by the way, a big shout out to them, who have been coming into work day in and day out to make sure that kids are fed, kids are safe, buildings are taken care of, so on and so forth. So they'll be included in that population as well. And what'll happen is they'll get an email notice from us that'll have a unique code. And all of this can be done from the comfort of your home. So you'll receive this email, you'll get a code, you'll click on the link, and that link will send you to an order site, and you will order a test kit. And that test kit will be shipped directly to your home address. And so there, once you get your test kit, it'll come with some directions for folks. But what they'll do basically is they'll schedule a meeting or jump online during a scheduled time with the provider on Zoom. And basically what that is to help walk us through the process. So it's a saliva-based test. So it's very simple. You'll just have to provide a saliva sample in a tube. They'll watch you do it. Really, the only reason is so that you do it correctly. There's really no accountability part to that. It's just really to help us get through. This is how you do it. If you have any questions, once they complete that, the employee will then seal that up, follow the directions, and they will ship it out. They'll drop it by a UPS store, and currently the results are coming in within 48 hours of you mailing your package. So within 48 hours, they'll be emailing employees back their results, which we're hoping, with our numbers going down the way they are, that we have a lot of negatives and keep that positivity rate down. So yeah, it's going to be super simple. The other thing, just to let people know too, is it is something that's required for employment, right? It's a condition of employment. So you can do it from the comfort of your home, or you can also do it during your contract hours at your work site. And for some of our folks that may need help or access to a computer, that's absolutely an option for them.
Man, it's like you're reading my mind with all my follow-up questions. And I've got to say, as somebody who's taken a COVID test now 5 times, sitting in line in my car for sometimes multiple hours, and it's not as bad as everybody says, but it is kind of uncomfortable to get those things shoved up your nose. It is refreshing to hear that you'll be able to just at home, simple spit test. That's going to ease a lot of people's minds. You said that it's going to be semi-random selection out of the people that are going to be working in the buildings. Can staff volunteer for this?
Absolutely. So there's a couple of things with this build. So people could volunteer for it. The way we're going to kind of roll it out at the beginning is we'll probably be selecting those people that are already in buildings, and then start looking at the people that will be coming in, and they'll be in our pool, but we'll do kind of that first. One of the things that's really important to myself, and I know our superintendent, is that we take the test first. So we can go through the process and be some of the first folks to actually take the test. But the other part is so we can help people out. So people have questions, or we'll be better to explain that. And so first round, yes, they can. The other cool part of this is something that we were told this week that will be available in the near future to all New Mexicans. So this will be something that they'll be able to do. What's really cool about it is the timeline. Once you get your link, you'll get that kit overnighted to you. through UPS. So the timeline is really short, and we can even use it if somebody was symptomatic. We could use that outside of that surveillance testing and say, you know what, we're going to assign you a code and not have you stand in line for several hours and go through that process. So there's a lot of really cool features, and I think it'll be exciting when it rolls out to all of New Mexico, because it may help everybody, and especially those folks that aren't able to get out, or even those that have compromised health. It'll be something that'll be really good. So yeah, it sounds really painless and super exciting.
Awesome. I have just one last question that kind of came to mind as you were talking about it. You talked about the people that are already in the buildings, and we're talking mainly custodian, administration, food service, who've been providing the grab and go meals. Thank you for that, by the way. I know you were instrumental at the very beginning for that. And we should have a whole conversation about that sometime soon.
Absolutely.
And then you mentioned people that will be coming back. I know there's talk from the state about the pods, the 5-to-1. And I'm not putting you on the spot. I promised I wouldn't put you on the spot, but can you give me a kind of an idea of who those people might be? Are we talking about small pod athletics? Are we talking about special education? Are we talking about K-3? Who can expect to be in that after the initial group, that second wave?
Absolutely. Great question. So currently what we're approved through the Public Education Department as a state, we're allowed to bring back our athletics in a 4-to-1 pod. We're also allowed to bring back activities that are under the New Mexico Activities Association. So athletics and activities that fall under that in a 4-to-1 scenario in a safe manner, following all guidelines, of course. Special education students is also another something that we've actually started. We've been allowed to do, and then that'll be another group. And then the final group that we'll be looking at we're allowed to look at pre-K through 3rd grade. So that's the next kind of big group that'll be coming. I know principals are working on that to kind of figure that out. And really the goal is, since we're looking at these kind of 4-to-1 pods, is to really help some of the students, the neediest students, right, that are struggling or that may not be as successful online as they would in person. So that's going to be that next group that'll be added to this piece.
Well, Gabe, I know you're busy. In fact, you're probably working on this very thing right now. I saw you on the phone with the superintendent as we began, and I really appreciate your time on this. I know you are super busy. As we look at the calendar, we are literally 1 week away from Christmas, which means 2 weeks away from New Year's, which means 2 weeks and 3 days away from staff starting to come back in the building. I know the state of New Mexico has pushed in-person education back past Martin Luther King Day, and that makes sense because we don't know what the holidays are going to bring. And I know things are going to change literally probably by the time we hang up today. I really, really appreciate you spending some time with me today. And I want to hold you to that. I look forward after the holidays to talk more about all of this, because this is just one tiny little layer of the myriad of things that you and your department division have to manage as we try to move, as we do move back into some kind of, I hesitate to call it normalcy, but some kind of in-person, and then as we move back into normal life, and you are to be applauded. You don't get enough recognition, as in my book. You're behind the scenes, and I know you like it that way, but from day one, grab and go meals, to today, surveillance testing, to tomorrow, whatever tomorrow brings, I can't thank you enough for all the hard work that you do for the district, Gabe.
Bill, I greatly appreciate that. And I have to tell you, I'd be remiss to say that I did it all by myself. We have an amazing support structure, and we work together. There's tons of people that are, the backbone of our district that from day one have stepped up and made it happen for kids, for staff, for our communities. So thank you for that. And I definitely, I appreciate that and accept that on behalf of all of my team that works together. And, one of the things I just like to end with is, together we can, as they say. And, as hard as it is for all of us, I struggle personally. I'm missing people, I'm missing things, But together, if we follow these things and we stick to a tough plan, someday soon we'll be together again. So Bill, appreciate you all, and thanks for getting our messages out and keeping our community informed.
Deputy Superintendent of Operations Gabe Jacquez, have a happy holidays, and we'll see you shortly after the new year begins.
Thank you, Bill. You too.